Being a pregnant woman right now, it can be kind of scary. I've seen firsthand when it comes to pregnancy during the coronavirus, there's so much uncertainty. For Kimberly Trieber and her fiancé Joshua Mancebo, it's been emotional and stressful. They're expecting their first child in April. And right now, there's very little data on what effects COVID-19 has on pregnant women and their babies. The CDC doesn't even know because the disease is so new. It's still learning the severity of illness it causes. But for now, Joshua and Kimberly's birthing plan hasn't changed.
We're keeping everything as planned. Again, checking with my hospital daily to see that, he's still allowed to be in labor and delivery with me. So we're keeping our fingers crossed and praying that doesn't change.
Initially, 2 major New York City hospital systems banned support people from labor and delivery rooms because of the coronavirus pandemic. The Mayor Bill de Blasio's executive order changed that. Now all hospitals in the state are required to allow women to have a partner in the labor and delivery room. So dads like Joshua can be by mom's side.
Our partners have been our partners. They're the ones that have been coaching us in breathing techniques, and they've been with us the entire way. So, I can't even imagine going through it without him by my side.
While things worked out for Kimberly and Joshua, for other expecting couples, one person in the room isn't enough. Leslie Everest is a mother of 4 and has been a doula for 26 years. Doulas often use the power of touch and massage to help reduce the stress and anxiety of labor. So, as you can imagine, social distancing and isolation protocols have not been good for her business. In some cases, Everest says doulas are being turned away from hospitals.
Pretty much across the board now, they're allowing only one support person. And obviously, if there's a partner present, it's going to be them who are going to be wanting to be in the birthing room. They're of the primary importance if that's the agreement between the birth giver and their beloved. So, it does happen occasionally where a doula will show up to the hospital with a birthing client, and we've still been let in, even though the rule is no, just because the clients often really advocate for us to be there. So there have been exceptions made.
Some doulas are now offering to stop by a client's home to offer labor support before the client goes to the hospital. Everest, who's the founder and director of Motherwit Doula Care based out of Canada, is creating online resources for new moms. There are virtual classes, even Google Hangouts, to create a safe place for moms to ask questions and vent. To protect themselves, pregnant women can follow the same protocol the CDC laid out for all of us. Cover your cough, avoid people who are sick, and most importantly, wash your hands. But there are some things the CDC cannot make recommendations for, like how pregnant women like Kimberly can cope with feeling robbed of the joys of expecting their first child during a global pandemic.
Do I want people around the baby? Is it even really the same? I don't know if I'm being like a brat, but I definitely feel robbed in that sense.
I want her to have the whole spectrum of the experience, from start to finish. And it's just been so crazy. I'm just trying to be as supportive as I can and trying to come up with new ideas. And I think, it's important to try to remain adaptable and flexible in this time. But I do feel definitely we got robbed, she got robbed. And I wish that, we didn't have to be in this situation. But here we are trying to take a negative, right, and make it into a positive.